Perfect.
So the main thing that I'll mention right away with the ear is that when you actually massage the ear, now I know because we were gonna, it's in the slides, and I don't know if you want to cover just the
Oh,
like
you
ear.
can
Okay,
you
so
can do
we'll
it.
we'll do like a little ear pull
Yeah.
with cartilage first. We'll start there, and then we'll start coming into massaging the ear. When we massage the ear, we get warm. The ears get warm, and the face gets warm. And so sometimes that can, I like to mention that, and I recommend that you as a teacher mention that if you have your students work to massage their ears, because it can frighten people. They feel like suddenly they're running a fever or something. So you just say, this is going to make you warm. And then I just make a joke where I'm like, if you're cold ever on a cold day, just rub
Oh,
your ears and you'll be totally fine because you're gonna warm yourself up. So, and then people are like, okay, cool. And then they know to expect it. So I just like to say that in advance. So we could start with just one ear pull. I can take the cartilage and then just hold onto here. Sometimes I can just think of, I mean, we've done a lot of other drills here, but even just resting my hand on the back of the head here, because with that ear pull, I'm influencing a lot of different things. Everything we just talked about on the reflexology chart, I'm influencing the temporal bone here. I'm influencing the tentorium, the membrane within the cranium, that tent membrane. And we can influence the trigeminal nerve, facial nerve, vagus nerve, glossopharyngeal nerve, the auricular nerves. And then we could take a moment if you want to kind of reset and sing after that side.
E. It's good.
And then we could take the other side. I like to just add a little support. I usually call the other hand my mother hand. So I'll come in somewhere and just have a mother hand that's just there to have a conversation with the nervous system, really. And then we can come out of that.
E.
E.
Very different.
So
Very different side to side. So
mine too, mine too. And then we can do little circles. So I can take the cartilage and just nice slow circles, just see what you feel there. Sometimes some people will have like click, 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 and sometimes it's really smooth. You can reverse that circle. And then I like to bicycle that circle, one forward, one back.
yeah.
And then from here, we can go back to the massage of the whole ear, where I can start down at the lobe here. I can work my way up to the antitragus on that opposite side right in here. I can work up through the helix, sometimes just even like unfolding it in a sense, just seeing how that is.
That's sore. Whew.
Yeah, some people's are really sore. Some people are like nothing.
Sometimes when I do this, my whole ear is sore. Tonight, it's not. It just that one
Hmm.
little, and now it's gone.
And
Hmm.
Very cool.
then you can come into the Simba here. Were you gonna do, are we
Yeah.
doing Z,
We could just do it
vibe
now.
later?
Yeah.
Yeah, let's go ahead and throw it in here.
Yeah. So, I mean, you can do it with your hand. You also can just do it with the Z vibe. So the Z vibe can go in the Simba right there. So the studies that have been done on this have been done with two kinds of stimulation. They've been done with vibration, vibrotactile stimulus like this, and with TENS unit, so an electro stimulation. This is the easier one to do, which is why I rely on it. So you can just, so I usually find that Simba by just tracing around the helix and just falling into that little space, just to make sure you know where you're going. And then I just go right in there and just vibrate it. And the study was 3 minutes. We don't have to do 3 minutes right now, but just that's what the study was, is just to do vibration there for 3 minutes for vagus stimulation. And just having a sense of like, does it generally feel good to you? I'm getting immediate saliva doing this myself. If this is too much with the light blue end, you can put this handle in there, which is going to be a lot less vibration, but for some people, that's the right dose. So you can see if one of those feels better. And then once you've assessed that side, of course, you can sing after that side, and you can assess the other side, of course. Trace around the helix and just kind of fall in there. And then you can assess that. I always try to notice if like one ear canal gets itchy or doesn't. That's
Tickles.
yeah. It's interesting when that happens to be like, is there some kind of nociception? So that like itchy feeling is a version of nociception. There's a threat receptors in the body. So good to notice that. And you just, everything's dose dependent. So you just go, do I need a lot of that? Do I need a little bit? Do I like vibration, or is this manual work better for me? I'm always using saliva as my assessment. So if we're looking for parasympathetic activation, more saliva is better. Not everybody needs that though. And it's good to say when we're doing this, this can cause a feeling of vasovagal response. You can feel a little faint doing it. So I always usually recommend you start it sitting down just in case. And if you start to feel like you're getting a little woozy, it's probably too much parasympathetic activation. So then you need to back it off if that's happening.
And then we can come to the other ear if you want it. Maybe you already did massage it. So I start at the lobe, come up to the antitragus, up along the helix. Sometimes I'm curious as to how different like piercings in the ears impact some of the rest of the body.
Me too. Yes.
And we can take a little hold of that tragus too. I like to come like behind the tragus and almost think of drawing it forward. I think
That feels good.
I did this a lot with people during, I mean, I'm still masked in my clinic, but when people were wearing
Christy, when
masks.
you do this, are you just staying on the outside, or are you actually going in to feel some of the cartilage?
Yeah, I actually go in to feel some of the
I'm
cartilage.
in the cartilage, yeah.
Okay, actually, we can do this tomorrow.
Yeah.
Great.